entering the room. Hi, my name is David Glassman. I'll be your student nurse today. I'm going to be performing a head-to-toe assessment, checking overall conditions, just keep an eye on things. Can I get your name and date of birth?
Mary Glassman, 12/25/62.
Okay. Any allergies?
No.
Okay. I would compare that with the wristband. I would raise the bed to working height, maintain privacy. Do you know why you're in the hospital?
I fell.
Okay. And do you know the date today?
9/4/19.
Okay. And after assessing orientation status, I would then ask the patient about their pain, noting the onset, location, duration, the characteristics, agitating or relieving symptoms, any related symptoms, any treatments they've tried, and the severity on a scale of 1 to 10, 10 being the worst and 1 being the least. After assessing pain, I would ask about their transfer status, seeing if they need any help moving around in bed, getting out of bed, or if they have any assisted devices, or if they need any help with ambulation. After assessing all those areas, I would then take their vital signs, oxygen, pulse, respirations, blood pressure, NO2. I would inquire if they've had any nicotine or caffeine within the last 30 minutes and then retake those vital signs if needed. I would then wash my hands again, raise the shirt. I would check the lung sounds, having the patient take a deep breath at each area where I am auscultating, moving in an S pattern, and also inquiring about shortness of breath, making sure they're not getting short of breath while I am listening. I'd also then check the heart sounds, S1 to S5, and then I would listen to the apopulse for a full minute, noting the rate and rhythm. After assessing the heart and lungs, I would then check the stomach area, looking for distension. While I'm looking at the stomach, I would check the skin turgor and the overall skin condition. I would look behind the underneath the breast area, underneath the axillary area, looking for redness or skin breakdown. I would also listen to the lungs, starting in the left lower quadrant, listening for up to 5 minutes if needed, or until I hear bowel sounds. After that, I would palpate the entire stomach area, again starting in the left lower quadrant. After assessing that, I would have the patient put their head or shirt down. I would raise the bed to 45-degree angle and have them sit up if able to. I would check the back, check the skin condition of the back. I would then check the lung sounds again, having them take a deep breath and moving in an S pattern, making sure they're not getting short of breath. After assessing the skin and lung sounds in the back, I would have the patient put their shirt down and lay it down. I would then check the head, noting any pressure areas, looking for lice behind the ears. I would check their hearing status. I would check again the neck for facial distension, checking the face for symmetry. I would check the oral mucosa, noting the dentation, and if I had a glove on, I would check the mucosa. I would then check the eyes, have the patient follow my finger, and also check the eyes for reactivity to light. After assessing that, I would check the upper extremities, palpating, make sure that any numbness or tingling, making sure their hands are worn bilaterally. Then have them squeeze my fingers and pull towards them and push away. I would then also check the radial pulse. I would check the cap refill, checking between the fingers, the fingernails, checking underneath the arms, making sure there's no skin breakdown. After assessing all those areas, I would then wash my hands and apply gloves, check the peri area, spraying the labia, checking the skin, making sure there's no skin breakdown. I would then have the patient turn over and check the buttock area, again checking the lower back, behind the knees, whole lower leg area as well. I would then, or get a visual, I would then remove my gloves, wash my hands, have the patient turn over. I would inquire about their bowel status and bladder, noting their last BM, if they have any nausea or vomiting. If it was continent, incontinent, I would also ask about their urinary status, if it was continent, incontinent, if they have burning or pain with urination. I would then also check their lower legs. I said I remove my glove and wash my hands. I would palpate bilaterally, noting numbness and tingling. And then checking for edema, I would have them push against my hands, go back. I would check their cap refill, check their dorsal pedis pulse and posterior tibialis pulse. I would also check the skin on the lower extremities, any pressure areas behind the knees. After assessing all those areas, I would again wash my hands before leaving the room. I would ask the patient if they had any further questions. I would put the bed in low position, call it within reach, make sure the room is free of clutter, and I would make sure that they just, that's everything.